special interest groups are trying to block progress on healthcare reform, derailing the debate with myths and scare tactics. Desperately trying to stop you from discovering that reform won't hurt Medicare, it will actually strengthen it by eliminating billions of dollars in waste and lowering drug prices. Tell Congress not to let myths get in the way of fixing what's broken with healthcare. Learn the facts at healthactionnow.org.
And we welcome you back. I'm Rick Sanchez. A lot of claims are adding to the confusion about healthcare reform. So we're here to try and separate fact from fiction for you. Our inside chief medical correspondent, Dr. Sanjay Gupta, is here. He's going to be answering some of your questions. Here's one from Cheryl in Indiana. You ready, Sanjay?
Yeah.
Is it true that seniors will get counseling about end-of-life treatments, and what does that really mean? Here's the part of the question that's most interesting. I've heard people calling it a death panel, Sarah Palin, but even that confuses me. All right, I got to tell you, Sanjay, I'm kind of embarrassed that as a news anchor, I would have to ask you whether the President of the United States is actually setting up a panel to decide what people should be killed and when they should be killed. But that's where this conversation has gotten to, so have at it.
The hyperbole here, I think, I'll go out on a limb and say this is hyperbole without a question. You're going to get emails about this, I am too.
That's fine.
That's the discussion that we're having.
The truth is important.
Yeah, this idea that you have, the truth is important here. And if you look at the language of the bill, which I think is very important, I've done this. This is what I've been doing as a journalist for the last several weeks. Right. Page 425, for people who actually pay attention to this sort of thing, that's the page where they're actually talking about what's become so controversial. Talking specifically, and I can read you some of this, advanced care planning consultation, defined as a senior, an elderly person, and a medical practitioner discussing advanced care planning. Two things they don't say. One thing is that you don't have to do this, number one. Number two is you don't have to abide by the recommendations of the physician.
But that, what you just described means if, heaven forbid, I love my parents so much and I can't even stop to think about what would happen the day I have to do this. But if my mom and dad got to the point where it was critical for them and they were near death's door, I would have someone that I would be able to talk to plan how me and my children and my family would deal with that.
That's right. And so the critics will charge, look, you can already do that. You can do that in an office.
And insurance would pay for that.
And insurance would pay for that under this House bill.
For that counseling.
That's right. And, by the way, I think part of this, if you read the language even more carefully, is that this should be done before your parents are ever at death's door. I'll give you an example. After the whole Terry Schiavo thing, which you and I covered extensively, I made a living will. I hadn't really thought about that in my life up until that point, but that was something I suddenly thought about. Living will, so having some advanced directives. How do I want to be treated if I am in a state where I may not potentially recover? One caveat to all this, because I've been doing so much research on this, you go to the geriatrics literature, look at the specific issue. What they find is this: if a counseling session like this does take place, elderly people are less likely to be aggressive with their own care after getting this counseling, because the doctors will lay out the options. Do you want CPR? Do you want defibrillation? Do you want a breathing tube placed? Do you want and an elderly person may say after that counseling session, I don't want those things.
Or religious people. You could have religious beliefs that say, you know what? I don't want to be put on a machine and kept alive.
That's right. But I think your point is a good one, Rick. This idea that it sort of conjures up this image of firing squads almost, to call it a death panel. There is no mandate that you have to have these meetings, and there's no mandate that you have to abide by these recommendations.
How in the world did we get from a meeting about people getting counseling in case, heaven forbid, somebody in their family's dying, to a death panel?
It's politics meets medicine, you know, in so many ways.
In so many ways. Sanjay, we appreciate it. It's good to have these conversations.
Thank you.
All right, man. Roads washed out after